back is out of whack, and you may be thinking that you are destined to a life of chronic back pain, but there may be hope. Sponsoring today's CI Health segment, Disc Centers of America, Dr. Richard Lohr is here. We're so excited to be here.
Thank you,
because this is some exciting stuff going on here.
Yes, thanks for coming over. Appreciate it.
Absolutely. So I mentioned, you know, there may be hope for people with chronic back pain. What's the hope?
Here's the hope. The hope is this. You can see actual people on the tables. These are all patients that are actually currently getting their proper treatment for what we call disc bulge or disc deterioration, disc herniation. This is a very common problem. What I love best about this treatment, though, is the safety. There's no possible way we can hurt anybody. That's number one. Number two is the effectiveness. It's very, very effective. What it does, it gets the water, it actually pulls the water back into a bulging, herniated disc, and it poofs it out, and it makes the hole where the nerve comes out, it makes that hole bigger, and therefore the pain goes away, the sciatica goes away, the numbness and tingling go away.
Okay, let's talk a little bit more about this prop over here, because this is a healthy disc, right?
That's a normal disc, yes.
And then what's happening here? The water is...
Yes, the water's leaking out of the disc from constant sitting, from trauma, from injury, just from old age. The water gradually leaks out as you get older. The older you get, the more hunched forward you get, the weaker the legs get. So this brings the strength and the nerves back to life, and so everything starts to function better.
Right. Okay, so this table here is the cure.
It's the cure. It's the spinal decompression table.
It looks just like everybody here is just kind of taking a nap.
It's the thing I love best about it is it can't hurt anybody, and it doesn't hurt. It's non-invasive. It's not dangerous like drugs and surgery and injections. Those things are dangerous, have bad side effects, downside. This has no downside. Worst thing that can happen, they get a little sore after a treatment. That's it.
Or they start snoring.
Yes, they snore. We see the snoring all day long.
There you go. And so this is the table. And how does it work?
What we do is we put a Velcro belt around the patient, and then we hook the patient up to these pulleys, and then we enter their weight and their height, and it's all computerized. It's all algorithms that are all figured out, so we have to pull the patient at just the right angle. Like I was telling you earlier, in the old days they did traction. Traction's a straight line pull. Right. It doesn't really do any good. Insurance still pays for that. But what this does is we set this angle, just the right angle. We can target the right disc, whether it's the L4 disc or the L3 disc or the L5 disc. We can target that disc and open it up and rehydrate it, get water back into it, and pain goes away naturally. So
they're kind of strapped in here and there, and then that's kind of where the pulling's going.
Yes, exactly.
And this takes 30 minutes.
30 minutes and you're done.
And then you kind of go and ice up and...
Right, we put an ice pack on afterwards because you might get the soreness. That decreases the swelling because we're pulling on something that's a little swollen. So that's where the soreness comes in. The ice helps that.
Right, so this is a great option if you don't want to have that invasive procedure or avoid surgery. How many treatments does it take?
Everybody's different. The younger, the less severe the problem, the fewer treatments you need. The older you are, the more stenosis, the more deterioration you have, the more treatments it takes. So it varies so widely. So it could anywhere from 4 or 6 treatments to 30 or 40.
And then it's important to keep up with the maintenance so that you aren't getting back into the hunched over state.
Exactly. If you do the maintenance, the treatment will last a lifetime. If you don't do the maintenance, people feel really good for about 6, 7 years, and then they're back to where they were. But if you do the maintenance, it'll last a lifetime.
Something new and exciting, you're actually getting a brand new space.
Right.
So where are you moving?
We're moving just down the street, just a block and a half. We actually have 3 more tables coming because we're growing out of this space. We just don't have the room. Can't get the people the appointments they would really like to have. Right. So that's why we're expanding. So we have a lot more room.
Okay, well, let's tell everybody where your new location is going to be come Memorial Day.
3090 is that the address, I think, North Main.
There you go.
It's just a block and a half down.
There you go.
The street, so we're real close to where we were.
We so appreciate you having us out here.
Thank you so much, Heather. Thank you for your time.
Cool technology going on here at Disc Centers of America. Likewise, if you need any information, definitely head to CILiving.tv after today's show, and we'll get you connected.